I would like to say that I've been doing an incredible amount of research, as you know, on thinking about, do I want to have a facelift or not at 80? And all of my friends say, well, what have you been hearing? And I tell them about different things. And then I tell them about you, and they say, now that sounds like a good idea. And so you have won the most popular award of my research to date. And I'm thrilled to share you with everyone who listens to the podcast. So, can you, first of all, um, tell us about yourself, what you do? A little background would be great. And then we can get into some conversation.
Of course. Thank you so much, first of all, for having me on this podcast. And it's an honor to be here with you. Um, you know, my journey through the stem cell world became because of my training. I grew up in a family of physicians. I always knew I wanted to become a doctor. Ever since age 6, I was running around my dad's clinic, looking at it and being at awe what the human body can do. I went through my medical training in the United States. I went to Albert Einstein Medical School in New York. Then I did a training in dermatology at Cook County Hospital. Then I did a fellowship in cosmetic surgery, doing breast and body and facelifts. And a lot of the training that we were doing, we were using fat at times to graft into the face and try to fix some of the volume loss. But the process that we were doing was very archaic and it wasn't working. And that led me into a journey of how do we improve this? I'm a fixer. I like to innovate and fix things up, like different patents of different devices that we've created. So we started looking at how do we improve this process so that the cells will survive. And at the same time, when we were doing that, we were finding out something very unique that we didn't know before, is that the stem cells were found in the fat, and not only they're found in the fat, that they're the most concentrated in the fat. So you have more fat, you have more stem cells in your fat than anywhere else in your body. And those stem cells in the fat are meant to regenerate, renew, repair, and basically fix all the damage that's going on with normal aging. And the process of aging is basically we're always breaking down things and we need to replace it and fix it. And if we break down things faster than we can fix it, then we're aging. And if we can replace it one to one, we don't age. And if we can do it faster the other way, we sort of grow younger. And when I realized that there are stem cells in the fat, I started to concentrate these stem cells and start to use it in my patients. And it really transformed how the skin looked. And the person that really transformed my sort of belief in what stem cells can do was a guy named Herzl. He had a big cancer that was removed on his face, and he was left with a hole and a scar that was basically burnt skin from the radiation, and all the scar tissue was tacked down onto his bone, and all the nerve endings were stuck in between the scar tissue. And he had gone to dozens of doctors and dozens of medical centers trying to fix this. And anytime they would try to cut it or inject it or do something to it, the skin would start to die and they had to stop. And when he'd heard about me doing stem cells. He came to me, he goes, "Can you help me?" And at that time, I didn't know what I was capable of doing with it. And I said, "We can try. I'm not sure what it will do, but it for sure won't harm you." So we did 8 treatments on him. Every 3 months, he would come for 2 years, and I would inject him with his own stem cells from his own fat. And it really transformed the tissue. His jawline was back, the hole was gone, his pain was gone, the burn on the skin was gone. And I really understood at that moment that this is not just taking fat and putting it in and getting some filling. This is regenerating tissue. This is a whole new concept that we didn't really have the power to do before. And I looked at my patients that were doing cosmetic surgery, and I saw that their skin was changing so rapidly. Within a matter of weeks, they were changing instead of months. So that got me into thinking that not only are the cells doing a lot, but they're also producing something that is making these changes in the skin. And I started researching that. I opened up a lab and I started researching what stem cells do and how they interact and what do they produce. And during that research, we really discovered something amazing, that all cells, be it human cells, plant cells, they all have the same language that they use to communicate. They may have a different dialect that they communicate, but the language is universal. And if we can sort of tap that language and use that language, now we can use the language of the cell and not even use the cell itself to do a lot of improvement in the skin. And that's something that was really novel. And we patented that technology, and we created skincare products that can be used like never before to actually regenerate the skin, to regenerate the tissues. So if you are using anti-aging products like vitamin C, hyaluronic acid, retinols, you're fighting, by definition, anti-aging, right? You're fighting the aging process that you've already seen. So you're trying to undo it by giving a signal to the cells. Here, we're taking the language that works with your body, and the body will understand and take what it needs from it. It's sort of giving the resources and the materials that it needs to do it. And I think we're in an amazing time for longevity, for health, for living a better life, not just a longer life, but a better life.
Yeah, I totally agree with you. So basically, if I'm understanding correctly, you then what you're doing is regenerating rather than originally it was just correcting, but now you're regenerating and letting the body correct itself naturally.
Absolutely. So before is like anything else. Technology has changed, transformed our the way we do everything, including fashion. I'm sure we're not doing the same thing we were doing 3,000 years ago or 100
Well,
years ago.
fashion's not that advanced. I'm sorry. We're a little backwards. We're still doing everything the old way. But
Well, I mean, but
I get the point.
materials you use are not the same materials that
Right.
they
Right.
used 100 years ago, right?
Right.
So the same technology that we're using, we're not changing the human body, right? I'm not changing who you are, but the ability to use your own regenerative cells, we didn't have. And now we have. So 100 years ago, we had the knife and we had stitches. And that's what we did. We took off the excess skin, we pulled it, it looked tighter. We said, great. But it didn't really look younger. You looked tighter. You didn't have the sagginess, right?
Right.
But with regenerative cells, you can undo it and give back the three-dimensional changes. You can put back the proportions, and it will take you back 5 to 10 years. And in 10 years from now, you will look better than you did before.
Okay. Sounds good to me. I think one of the things that my takeaway in all this research is, well, I feel great inside. I want my face to look the way I feel. But I don't want to look different. I just, I don't have big lips. I don't want big lips. I have a big nose. I don't want a small nose. I just don't want to change anything. I just want to actually regenerate what I have. And so Explain a little bit, and you did such a great explanation for me when we first met on what it is you do. That's first of all, and I love the way you presented it was, and I think maybe my question was, why should I do what you do versus surgery? And so, what's your answer to that?
Well, the answer is exactly what you said. You want to look like you. You don't want me to change the way you look. So the stem cells are just restoring what you had. We're not changing who you are. When I cut and pull, I'm changing the direction of the muscles, the skin. It will change the way you look and the way you animate. When you smile, when you make movements, that change will show. And you're already thin. So it will just thin out your skin more. Instead of building it up and restoring it, we're making it tighter, and you're going to be more skeletonized because you're already thin. So you're going to look older, but you look tighter. That's one. Two, you'd have to go under general anesthesia to do the traditional facelift, which in general is terrible because it has the risk of the anesthesia itself has a risk of death, which we don't need to take, right? If we do it with the stem cells, is it done under local? I give you a pill, you relax, and that's it. And you don't need to take that big risk. The other thing is you're older. So you don't want to be under your brain function actually deteriorates a lot after having general anesthesia. So you're doing this to look good so you can live better, so you can function
Right.
better. Now we're doing all these other things that are sort of undo all that hamper all the sort of health that you have. So we want to optimize your health. We want to give you everything without risking things that we don't need to risk. So the biggest risk that you're going to take doing the stem cell lift is basically infection and bruising. Those are the two biggest risks. And the swelling is part of the procedure. It will go away. But you don't have the risk for scarring that is going to look bad, or for the muscles or the nerve endings that we may cut in a traditional facelift. We don't have all those things. And the other thing is we're restoring your natural proportions. So the youthful proportions are going to be restored, and you're going to look more rested, healthier, younger, but you will look like you. And most people that don't tell their friends what they've done, they go out, and after not being out with them for a couple of months, they see them and their friends tell them, "What did you do? Your hair, you rested, you look good. Did you do
Right.
they can't figure it out because it's just part of who you are.
Yeah, I appreciate your elaborating on some of the negative effects of general anesthesia. After I one of the things that I ask is, do you have an alternative to general anesthesia? And some don't, and some hesitate, and then others like you say, no, that's what we do. We don't use general anesthesia. And I reached out to a very well-known, well-respected doctor who's a very well-known person in brain health. And I asked him about general anesthesia, and he wrote the longest note about absolutely do not, under any circumstances, unless you have to for life and death, do not. And I thought, I said, okay, no, I wasn't planning. I just wanted a backup on it. So it really, I agree with you. I believe that being on the safe side and using other means is a good alternative. And then when you explained to me the difference between surgery and what you do, I thought that was really helpful too. And so, talk about the difference in your procedure.
The procedure is very different than traditional facelift because we're not going to be cutting you. We're not creating any scars. There's no open wounds. Everything is done in a closed system. So the first part is we give you the pill. We mark the areas that we're going to take the fat from. So the bonus of this whole procedure is you're going to take it from where you don't want it and put it where you do want it. So you can choose any part of the body. And we've actually done studies looking at the stem cells in different parts of the body, and if it makes a difference, if I take it from the belly, if I take it from the thighs. And at the end of the day, it doesn't. The end result is going to be the same. And one of the amazing things is that it doesn't matter how old you are, your stem cells in the fat stay, and they are very good because that's what keeps you alive. That's what's keeping everything renewed. If we lose that sort of resource, we can't stay alive. We can't renew ourselves.
Right.
So that's an amazing thing that we can take fat from any place, concentrate that fat, and then inject it back very, very precisely into the area. So we're going to sculpt the face with the stem cells and with a little bit of the fat to give volume. And all you're going to have is a little bit of needle mark from the areas where we go in. And there's only 3 or 4 areas that I puncture to go into the skin. And the biggest thing about the sort of recovery is the swelling. So most people look at themselves in the mirror and they see the swelling and go, "Who is this person? What did I do?" But the swelling quickly goes down, and within 2 weeks, that swelling goes away. But within 6 weeks, you start to see the changes in the skin. And the first thing that most patients actually notice is the glow that comes back into the skin. That youthful sort of elasticity comes back to the skin. And by 3 months, the cells have incorporated into the tissues, and whatever the volume that we get at that time is going to be yours permanently. But the healing process continues, and your skin will improve over the next 6 months to a year. So a lot of times people come back at 3 months, they look great, but they come back at 6 months or a year, they look even better. And you don't need to be under general anesthesia like we talked about. But if you take the pill, you need somebody to take you home because you're sort of drunk from the medication. You're sleepy. You don't want to be driving or doing business under that influence.
So one of the things that scares me about putting fat into the faces, and I'm sure you've seen this, where you've seen women who have done something and they have these huge faces, or they have distorted cheekbones that are way too big, and so I think the fear of having this face that's filled with fat is like, oh my God, how do you get rid of that if it's, if the skin, if you're going to kind of be continuing to build on that. So what's the safety on that?
So to your point, the art of medicine is important. You have to understand what tools you're working with and how to do it. And you have to have an aesthetic eye. You need to know how to use and how to perform these procedures so that you don't look awkward, right? If I inject it just in one place, it doesn't work. Everything is connected. You need to put the right proportions and restore the right proportions. It's really sculpting the face that makes it look good so that we can get the right contours. If you only put it in your cheek and you don't put it on the side, yes, it's going to look odd because you're already lost the volume on the side. You're already drawn and squared looking. And now making one place 3-dimensionally protrude out so it will not look in place. But if you do the whole face, it looks much more imbalanced and it looks a lot more natural. And the whole idea is not to just stick fat in there, is to restore proportions, is to restore the elasticity and the integrity of the skin through the stem cells. So the volume that we're doing is a little bit of volume. Most of it is just regeneration. Um, and you can do the whole entire face. If you do traditional facelift, every part of the face cannot be done with one procedure. So it will take like 9 different procedures to do your forehead and your eyes and your cheeks and your lips and your jawline and your chin. And with the stem cell lift, I can do the entire face, including your neck. So everything sort of matches in one procedure with the same tool, and it all matches and it all looks good. Um, if we just do, bits and pieces of it, sometimes it doesn't look so natural.
Yeah, I was going to ask about the neck, and you added that. What about hands?
For sure.
Is that like the most popular one you do?
Well, I always think it's funny that we don't address the hands a lot. In my practice, I do, because it's the same thing that's happening on the face is happening in the hands. You're losing the volume, you're losing in elasticity, and it's looking skeletonized and it looks old. So if you're going to do the face, you should do the hands because that's going to match.
Yeah.
And with the stem cell facelift, we can do everything in one procedure very easily because it's the same tools, it's the same injections, just a little bit more volume we need to take out to get enough cells to do this procedure. With a traditional facelift, what do you do with the hands? You don't really have an option to cut it and pull it. So we were left with fillers or with lasers. They're okay, but they don't do regeneration. They're just burning things. It just looks a little bit pudgy if you put fillers in. But if you do the stem cell, it just looks youthful and it matches. Everything looks much better.
Right. So a question, anytime that I spoke about you and what you do, one of the things was, he takes fat out. Can he take all of the fat from my stomach out? And I thought, I'll ask that question. So do you ever do like a liposuction thing at the same time?
Absolutely. You can combine the two, but getting the fat for the injection is a different process in terms of what I do. I want those cells alive and I want them healthy so we don't damage them. So the process I do is called lipoharvesting. We're doing a true harvest. We want those cells to be really healthy. With the liposuction, we don't care if those cells are going to stay. So we're a little bit more aggressive. We use different pressures. We use different things. Is it the same process in terms of the numbing and in terms of the size of the cannulas? Yes. So you can do them, but for me, it's 2 different procedures done at the same time. For the patient, it makes no difference because it's the same amount of needle marks and the recovery is almost the same.
So I had a podcast with an incredible woman who has been doing research with stem cells for quite some time, and she's making incredible progress. And she was talking about that more and more people should be banking their stem cells. And so, do you bank stem cells as well?
So I believe you should bank certain cells that we won't ever have a chance to get again. So cord blood is a one-time chance. You only can get that just during that birth, and that's it.
Yeah.
I don't know what science will discover in 10, 20 years. That's sort of having insurance. I like to keep that and say, that's my insurance. If we need it, God forbid, for whatever, we have it. But for adults, most of the stem cells that we use is mesenchymal stem cells, and the fat has so much of it. And like we discussed, you have it. Now, certain people believe that you should continue to inject your cells. I don't think that does a whole lot long term. None of the data shows that taking your cells, banking it, expanding it, and injecting it every few months changes things in a great way. Now, also it's expensive for most people. But by banking it, and expanding it. So there's two different things. One is taking the cell and just storing it so that in case you need it later,
Yeah.
you have it and you can use it.
Right.
And the other one is taking that and increasing the numbers. It's called expanding the cells.
Right.
So you grow it in the lab, but when you grow it in the lab, you lose some of the other cells.
Quality.
You only
Yeah.
grow one type of cell at a
Yeah.
time. And in my own lab, we have done all of this and we've tested all of this. I've been doing stem cells for 25 years. And in this 25 years, we haven't seen huge benefits of banking and doing it for any single purpose. I'm not saying it can never happen, but when we have your own fat, if you have a little bit of fat, you're okay. So you got to not be too skinny.
I'm not skinny. My face is skinny, but I'm not skinny.
Good. We need a little bit of fat, and then we can do it.
Yeah.
But if you want to bank it, I'm not opposed to it. I'm not saying don't ever do it. I'm not sure if it's worth it.
Yeah, at this point, maybe.
Right.
Yeah. Then, so talking about so now we're thinking about recovery, and I go home with somebody taking me home. And then what should I do?
So the most important thing is to ice, because that swelling is what is the most difficult thing for people to look at themselves and see themselves swollen. So I have people ice for 4 days, because the healing process for the first 4 days is inflammation. So it gets more swollen. If we minimize that, it's going to be very useful in the recovery phase. So we ice. If you have any discomfort, you take Tylenol. I give you the relief serum, which is the plant-based serum that reduces the inflammation and the swelling and the discomfort. So your healing time is reduced tremendously, and your sort of results are increased exponentially, because those cells have those factors that direct and communicate with your own body and helps to guide it in the direction we want. After the first 4 days, you can do warm compresses. You can start using the regenerative serum to improve the skin. What you're going to feel on your body is going to be soreness for 2 days. 2 weeks, and it's going to feel like a muscle soreness. Like you had a good workout and it feels like a muscle soreness for 2 weeks. And those 2 weeks, I recommend for you not to do exercise, because you'll get more sore. You can't harm yourself in any way doing these things. It's just you get uncomfortable doing it. So let it heal. It gets better very quickly. Then you can go back to your routine. The very next day after the procedure, you can do daily routines. You can go out. You can drive yourself. You can do everything that you normally do. And after the first initial swelling goes down, you can probably start doing your exercise and your normal stuff in a very short time afterwards. The area that we take the fat, we also give you a girdle or a binder to wear for a few weeks, so that the skin will contract and it's more comfortable for you, just like you do for liposuction.
Interesting. So then exercise would be probably after 2 weeks.
Yes.
And then, so after 2 weeks, so you said there's possible for black and blue and swelling. So the swelling is going down, and black and blue. How long does it take for black and blue to fade away?
So the only thing sharp I use is the numbing medicine. So if I'm putting the numbing medicine in, like we do going to the dentist, if I hit a blood vessel, you get a bruise. If I don't, the stem cells are injected with cannulas. So there's nothing sharp to bruise you. So the bruising is very little usually. If there is bruising, it's very little. And usually within a week or two, that bruising goes away.
Oh, great. And then, so you talk about the serum so tell us about the serum and what's in it and why you developed that.
We developed the STEM product line because we wanted to use the natural intelligence of the cell. So we call the product STEM Natural Intelligence, and they're all plant-based. So we talked about the cells having the same language. So we have different products that do different functions. One of the products is good for pain, inflammation, and swelling. So the repair product in the laboratory, when we tested it, those factors are the factors that tell your skin that's what we want to do. We want to reduce the swelling. We want to reduce the bruising. So that's the first thing that we use. Then we switch to regenerative serum. So the products in the regenerative serum are telling you those factors are saying build the skin up, reduce the wrinkles, improve the skin elasticity, and get the color to be more uniform. And as you do that, it sort of improves and works with the stem cells inside the skin to get everything to where we want to be much faster and much more effectively. And then you can continue those treatments to maintain the skin integrity and keep the skin young, because like we talked about, all the factors are there. So the skin will take what it needs, and this sort of dialogue that's going on between the cells will tell them what they need to do at what stage. So it's not like we need to use one product now and then one product 6 months from now. Once we've passed the initial inflammatory stage, then we can go into the reparative stage and use the products that do that. And then we give you moisturizers, and we do synergistic effect of building the moisture in the skin, reducing the glycation in the skin, which gives you that leathery look in the skin. So we want to undo that, and we want to prevent it. So a lot of the testing we did actually shows not only we're able to build the collagen and elastin, we're able to prevent the breakdown. So not only we're building it back and keeping it youthful, we're preventing it from breaking down. So you're going to maintain it, and you're going to keep that result for much longer.
And so what would you say is the length of time that someone could expect this process to the sort of regeneration and the new sort of approach to looking good? How long do you think that would last? And do you need to do sort of touch-ups or follow-ups?
Yeah, fantastic question. So at 3 months, the changes becomes permanent. Whatever cells and volume we get, that it becomes part of the tissue and is yours permanently. You don't stop aging. It will continue to age with you, and it will look very natural because it's part of the tissues. But like we said, it's going to continue to improve over the course of the year. So you're going to see improvement, and you're going to start to notice little things over the course of a few months. But once those things are settled and it's incorporated, that permanent change sort of makes you grow younger. So now you have more resources, you have more stem cells, you have more ability to maintain that. So I've had patients come every 5 years to 10 years to do it sort of a refresh of their skin and of their face, because you don't stop the aging process. But they still look better at 10 years than they did when I first did them. And unlike when we do traditional cutting and pulling, when we create scar tissue, when we're taking away the blood vessels, when we're thinning the skin, and everything is sort of moved around, and it's much more difficult to do a secondary facelift and much more dangerous. Here it becomes actually easier. You have more resources, you have more infrastructure, everything is just healthier. So when I do the second treatment, it becomes even better than the first time that I did it, and much easier because we're not scarring anything. Um, the 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 need to do a second treatment before that time, let's say we inject you and you're very thin and you don't have a lot of the resources, it may be that we may need to come back in 3 to 6 months to do a secondary treatment to sort of get the fullness that we want and the results that we want. That is very individually oriented based on the amount of skin laxity, how much skin there is to tighten, how much volume there is to improve, how much fat there is, what the quality is. And those things are very individually based, and you don't really know what's going to happen until you do it, because this is a biologic change. This is a change that we're giving your cells do their thing naturally. So we need to optimize the body to get there and do those things.
So when we use the term facelift, it means we want to reverse the dropping of everything. And so I could be wrong in my description, you'll correct me, but in traditional facelifts, they're lifting up muscle and everything, right? To lift up the
Sometimes
face.
depends what kind of need the person has. So the most people take off skin. Some people need to take off a little bit of the laxity underneath. It's called the SMAS, which is the sort of fascia that sits under the skin, and sometimes the muscles. But most of the time is that sort of the under the skin that you just tighten that. So we put stitches here and we tighten it here and we tack it down so that it stays. When we're doing that, we're lifting the tissues underneath, and then we're pulling the excess skin and cutting off the excess skin and pulling that tight. That gives you a 2-dimensional change, not a 3-dimensional change. Your aging process is a 3-dimensional change. You're losing things not just because it becomes looser and gets saggier, but your volume goes away so that everything sort of comes down and they start to hang where the folds are. The laugh lines and the jowls is where the skin has nowhere else to go. It just sort of falls there.
Yes.
And we're like, we don't like this.
Mm-hmm.
So when we're doing the traditional facelift, sometimes if you have a lot of that and we have to pull it tighter to get rid of it because we don't have the 3-dimensional aspect, we only have the 2-dimensional aspect, we're actually pulling the skin a little bit too tight, or the SMAS a little bit too tight, and it causes the mouth to sort of be pulled and gets a little bit wider looking, a little bit not natural looking, especially when you talk or when you smile. It just doesn't look so right. And if you don't do that, then you have the gel still, that you didn't fix the problem to begin with. With the stem cell, if we're doing a 3-dimensional change, so we're lifting up and out. We're going and bringing the skin to where it used to be. I give an analogy of the grape. So when we have a grape, it looks nice and smooth and juicy and full. When it becomes a raisin, the water is gone, the skin is thicker and harder. So what we're doing in a traditional facelift, we're taking that grape, we're stretching out that skin, and it looks smoother, but it's not becoming a grape again. That raisin still, it's not a stretched raisin.
Yeah.
So we need to restore what's been lost. And what's been lost, the stem cells it's cells that are tasked by genetically. We don't have to do anything special. We just need to concentrate them and put them in. They are tasked naturally to do that. So when they see that there is not enough collagen and that there isn't enough blood flow, they build the scaffold. They build the sort of highways and the blood flow and everything that's needed for the cells to regenerate and renew. So you're getting the grape back. And that we weren't able to do before. So when I talk about technology changing everything, this is one of those things that is changing how I approach medicine. Not just for cosmetic, also for autoimmune disease. I treat a lot of people with autoimmune disease. There's a disease called lichen sclerosis that affects women that there is no treatment for. And I've treated 400 women with this debilitating disease, and a third of them are in remission. They don't have the disease anymore. So we have to sort of think outside the box now and say, what is the purpose of these cells and how do we use them to the benefit of our patients?
Wow, that is really amazing that there are other uses for what you've discovered. That's fantastic.
Yes.
I know you also talked about the different steps in how you achieve this goal. And one of the steps is that you do some microneedling and other things to sort of prep before you do the procedure. And can you explain why you do that?
So, the cells need direction. These stem cells are like soldiers. They need to be told what we need them to do. If I take these stem cells and I inject it into a knee where you have a tear, and the stem cells have sort of a homing mechanism like radar, and they go to it and they start to heal it.
Yeah.
The same thing needs to happen in the skin. I need to tell it what I want it to do. So I do a lot of biohacking things to get those stem cells to understand what I want them to do. Part of it is from the signals we get from the outside, and part of it is signals we can do from the inside. So from the outside, we can do microneedling, we can do radio frequency, we can do red light, we can do blue light, we can do lasers, we can do sort of chemical peels or chemical things that stimulate the skin. We can do our plant stem cell factors that will stimulate them. So all of these will work synergistically to get those cells to sort of know exactly what we want them to do, and they will get the job done in a much faster way when they have those directions. And a lot of these things work synergistically. So if I do the microneedling with radio frequency to tighten the skin, and then I put this stem cells, I get an additive effect. It's not a 1 + 1, it's an exponential change. So I get 1 + 1 doesn't equal 2, now it equals 4. And we're able to get a much better result, much faster. And then for the wound afterwards, this is so, during the treatment and afterwards, we can continue to do these things. We can use devices that also help microvascular circulation. We can do, electromagnetic field. There's so many different things that we can do to sort of improve and optimize.
Yeah. So it keeps it sort of regenerating and active. That's amazing. That's really fantastic. So my last question is, so from a health perspective, you seem to be very conscious of using plant-based products and looking at things more naturally. What kind of a diet should someone think about for great skin? I mean, what would you recommend, just to say before or after, or just even if you are living life, what makes for the best skin, and what practice, if there's anything that you could add to that.
The skin is a reflection of your body. I mean, it's the biggest organ we have. So whatever we see on the skin is happening everywhere in our body. I think the most important thing for people who want to live longer and healthy and not get sick, I think number one is hydration. Most people in the world are dehydrated on a daily basis. And I think most people who end up getting heart attacks or getting a stroke is because their blood sort of thickens, and then the vessels aren't as wide, and then you end up getting a clot, and that's it. You get sick. If we hydrate, we're less likely to do that. And when you hydrate, you see less wrinkles, you see less of the dryness in the skin. When you get dehydrated, if you go into hot water and you put your hands in for a while, you come out and you see all your hands being wrinkled. That's because you got dehydrated. Even though you're in water, right? The water took out the water out of your body.
Yeah.
And you need to supplement that back. So that, number one, I would say hydrate. Because everything most people do today is dehydration. Coffee, tea, alcohol, all that is dehydrating. So hydrate, hydrate, hydrate. Number two is having more of a plant-based diet. I think a lot of the food that we eat is processed, has chemicals in it, has hormones in it. And we can't get away from it. I'm not saying, go and not eat anything, but you have to have a balanced diet. And a lot of the balanced diet is that you don't, in America at least, we don't have enough fruits and vegetables. People, get a hamburger, they put a little lettuce on it, they think that's a vegetable,
Right.
And if you go to Mediterranean diet, they're having 10 different kinds of salads, and like a lot of vegetables. I think that is important because those vegetables give you fiber, they give you water, they give you minerals, they give you all the nutrients that you need. And for to optimize any result during any surgery, you want to make sure you're hydrated, you have enough protein. So you got to have food that has a lot of protein, and those things will help you heal better, will have less risk during the surgery, and your recovery will be very good and the results will be very good.
Well, this is great. I think it's very clear, and it's really fascinating, and I'm totally intrigued by it. And like I said, everybody wants to know my findings, and when I give them the lay of the land, your approach really is unique and also very appealing. So I really appreciate you coming and spending the time and explaining it so beautifully. And I'm thrilled that you're using this technique for women who have issues that need support in some way. So it's fantastic. And thank you so much. This has been a great podcast.
Thank you so much for having me. It's been a true honor to be here. And, I think one of the things is because we talked a lot about surgery, I think one of the things I just want to add is that even if you don't want to do surgery and you just want to have the next generation of healthcare or skincare, you should look at products like regenerative skincare products like STEM, Natural Intelligence, the product that I've made, because those things are going to change how your skin is on a daily basis. So you don't need to get to a place where you need to do big surgeries.
Yeah.
And I think maintaining our youth is a big part of it. And I think we're getting there. We're getting there.
Yeah.
And I'm very happy that, people like you are on the forefront of this sort of pioneering the way of, new thinking, because most people, when we talk to them 10 years ago or 20 years ago,
well,
they weren't there. So thank you.
Yeah, things are moving very quickly, and I think this approach is in keeping with the way everything is going in, especially with AI and all of these fast changing improvements and inventions and innovations. So this is very innovative and very exciting. So thank you again. And I'm certainly going to be trying your products. I can't wait. And then I have a date in my head where I'm going to make a decision, and I'll let you know.
I'm waiting.
All righty.
Excited.
Thank you so much.
Thank you.
It's been great. I appreciate it. Have a good day.
You too. Bye-bye.
Bye-bye. Hey, press follow and leave a comment after you listen to the podcast. Thanks.